Yeah, because my name is Robert Talley, and I just let you know I am documenting this recording. I don't know who I need to speak to or how to go about this the correct way, but I am not being defiant. I'm not trying to manipulate battle or anything when it comes to me trying to get help. So that's the first and most important part. The I don't know the lady's name, but this has been going on for over a year now, and she's supposed to be like the head lady of the Lake District Wellness Center. I am currently a patient at the Christmas Valley office. That being said, there was an issue that was brought up that had to do with a reserving our rights for a civil litigation due to issues that were provided to the courts from the probation department out of Lake County as true and accurate information, which violated my Privacy Act law and under HIPAA because it was documented, and that's the reason why I actually got a violation, because there was no release of information signed. That being said, when I got out, I was supposed to do an evaluation, which I did do. And when we went to court, it was advised on the record that due to this information, that at this point they were advising the courts that this is civil litigation on the civil aspects rather than just the probation. That being said, it seemed to me that the lady didn't really want to look into it. The definition of compliance, she really doesn't even know, and she doesn't want to take her time to contact an attorney or whatever. And that being said, fast forward, the probation officer is forcing the SUD part. That the evaluation came back that until my mental health was stable, SUD services didn't need to be, I don't know the right word, instigated, or it didn't need to be implicated or whatever. At this point, the probation officer, I guess, got a hold of the supervisor for the secretary there in Christmas Valley and wants a appointment to engage in the SUD part. That being said, I've taken the time with my therapist and even Fawn, the SUD worker there, and nothing's changing in the system. And that being said, that makes my mental health and my smooth, stable part of my life, it makes it even worse, because it's battling or trying to figure out what the issues are going on rather than me getting help. It feels like the business is more about them helping other agencies. And I have the information to prove that it is unconstitutional, and it's upheld by the Supreme Court, that the probation officer doesn't have the right to force any type of program on anybody. That's the evaluators that do that. And since the last evaluation said that the mental health worker is the one that has to decide when I'm able to engage in those, at this point that's not a possibility. I go to therapy every Wednesday, and last Wednesday it was talked about, and right now it's just not something that is going to be beneficial or even help because of things that are still going on in my life. I'm
So did this,
Go ahead, sorry.
sorry. So did this all happen in Christmas Valley?
Well, that's where I do my services at, but the
Uh-huh.
second evaluation, which was the one after I got out of jail, was done in Lakeview. And when I
Okay.
did that, the person that does the evaluations, she was going to recommend intensive outpatient treatment. But because of the confusion between employee and boss, she didn't really know what to do. So the boss basically, I think it started with an S, but she basically said, until the Haley is okay with me engaging, they're not going to force it, but it was recommended for outpatient, but just not when to engage until the therapist says that it's time. I don't know if I'm articulating my words correctly to have you understand that, but
Yeah.
so that being said, there was an email sent, and the secretary wanted to get me started with SUD services, but yet at the same time, there's the issue of under the rights of probation, that's the probation officer's duty to do their job. Okay, manipulating a system which violates clients' rights, such as test results or anything that goes beyond just compliance, is especially when it comes to test results. Test results have to be signed specifically for that information. And the way that the system there, and that's what my opinion, that they're so used to doing something that they don't want to make a wave in the water. So due to the fact of them not wanting to make a wave and them willing to still violate other people's rights because they don't want to look into what compliance actually means, they're not giving no reassurance that things are going to change. And what I mean by that is, apparently when you do your swabs for your tests, those test results get sent automatically to the PO. Okay, there's no reason for that to happen, and because the PO is responsible to do their UAs if they think that there's suspicion of drugs, and there's budgets in the budget for them to do that, such as if a probation person pees dirty, they have to pay for it. If it's clean, the state pays for it. So it's more smoother for them to just keep doing what the system's done rather than actually even communicate or stick up for clients. Then you get what I'm trying to say?
Yeah.
And I don't know really what to do.
Yeah, that's definitely a lot. Okay.
And in regards to the Constitution upheld part, was probation officers have been usually like what's going on now, the POs wanting something done. Whether the PO wants something done or not, they have to do it within the rights of that individual, or even constitutionally. So the POs, letters with their professionalism, and drug and alcohol letters, and then you got the mental health letters that those are the professionals that are in that field. And a probation officer, such as other than actually knowing that they're on medication, they're really technically not even supposed to know what kind of medication the person takes.
Yeah.
So when the PO's demanding the SUD get started because time's gone by and nothing's been done, I'm ordered by the courts to do mental health. I'm not ordered by the courts to do SUD. I was supposed to do an evaluation and follow through with the evaluation within 30 days. I did that. That's over a year ago.
Okay.
So I don't know what to do because I don't really want to battle this. Talking to Haley about it, she talks to her boss or whatever, and then recognizing the frustration from not just my therapist but even Fawn on not really getting no results. And if a business is going to be a business, they need to actually protect the people that are there to get help, not just make it smoother for another entity.
Absolutely. Okay, so who is your current therapist right now in Christmas Valley?
Haley.
Is it Fawn or Haley?
Haley, yeah. Haley does the mental health, and then Fawn does the SUD. And I see Haley every Wednesday, and we've talked about this, and Haley doesn't really but she doesn't really take the time during our sessions to, worry about SUD, because SUD right now is still in the back burner because there's still a lot of issues going on the mental health side.
Okay. How often do you see Fawn?
I don't see Fawn. I see Haley every week at 2 o'clock on Wednesday. I see Haley.
Okay. And so you haven't been doing your SUD lately?
No. So the what happened was last June or July, I got a sanction because of not signing a release of information. That being said, my release of information was revoked in February. Now, I don't know why or how, but somehow, some way, under true and accurate information filed to the courts by Lily Frank from the Lake County Probation Department, she had the test results from May and June even, which is months after my release of information was revoked, and it was verbally even stated because there was the battle between communication of my therapist and then the SUD worker and the main boss or whatever. And then when I got sanctioned, that's when it came up to the courts on record that we were reserving the right for civil litigation, and we were hoping that they were going to figure it out. That being said, when I got out, I had to do the evaluation. I legally had to advise them that at this point to let you know if I'm going to engage in services with you guys, my rights have already been violated, but things need to change if this is going to continue, because this is a violation of my rights with you guys sending results directly to the PO.
Right. From my understanding and from what I've seen and what I've done, our swabs and our tests don't go directly to PO. They go directly to labs.
Well, they send them to the labs, but the test results, I guess when they come back in the computer system or whatever, they automatically gets forwarded to the PO. That's a violation of people's rights because those are actually test results. That's nothing to do with compliance. So,
and you didn't have one, sorry, I'm just trying to clarify here. You didn't have an ROI set for them to get those results. They were just automatically sent to...
that's how that's how your guys' business system is and has been. That's what they don't want to change, or they don't want to look into it, because your guys' business is saying that that's part of compliance, and that's inaccurate. The only thing that PO is allowed to know is if the person's in compliance or not, and that's not test results. So, for instance, like I take hydrocodone. My PO was ready to violate me because I had opiates in my system, because all she did is read the test results. So you have somebody that's looking at somebody's, or has the power to take somebody's freedom away, and ain't even have the letters in that department, or even understand how to read result test, because it starts on the top and then they break it down. Apparently on the bottom it'll tell you exactly what it is. And yes, they don't even know how to read the test results. So I don't really know what to do at this point. And I can find the numbers or letters or whatever it is for the Supreme Court that actually touches on this actual topic in regards to probation officers overstepping the rights. And so, for instance, an example, on probation, they say you're not supposed to associate with anybody else that's a known felon or on probation. That's a violation because it doesn't actually narrow it down to an individual. So if there's a no contact between an individual, the PO can enforce that. But if it's just a generic thing like that, it's not specific and it's not upheld. So, and that's by the Supreme Court, they acknowledge that.
Okay.
And to let you know, for a little insight, I do have autism, and when this stuff goes on, it makes the symptoms worse because I have to try to understand it, and then the more I understand, I learn things that I didn't know, and then that even throws fuel on the fire, because I have these professionals sitting here wasting all this time back and forth focused on one thing, and making my sessions, 50-60% of my sessions have been dealing with the legalities of what a business should do or what they need to do. Like, there wasn't no question at all from the supervisor to schedule, the email that went to the secretary saying, we need to get SUD services, schedule him for an intake. There wasn't no discussion from even the supervisor to Haley to even find out how I was doing, or if it was time, or nothing like that. And all because the PO picks up the phone and gets on that lady's ass, I guess, wanting me to do SUD. I didn't mean to cuss.
That's okay. I understand your frustration. Can I get your phone name? So it was Robert, I believe. Right?
Yeah, Robert Talley, Tally, and my phone number is 541-936-3169.
How did you spell your last name again?
Tally, Tom, Adam, Lincoln, Young. And 3980 is my birthday. I don't know if that matters in your guys' system or not.
Look you up real quick.
And then, this is the other part that I would like an answer to, and I haven't asked Fawn, but in regards to getting treatment through your guys' agency, are you guys recovery based or are you guys abstinence based? Do you get what I'm trying to, like, the difference there? So for instance, recovery means to be able to help the person better themselves. So that being said, for an example, Fawn, being an SUD worker, she cannot allow any of her clients to take any type of like benzodiazepines, opium, or opiates, nothing like that. But if it's a recovery based, that option should be there. Because, like, say for instance, Dr. Thiel was going to order a med for me. She asked Fawn, and Fawn said no. My therapist didn't even have an input or wasn't even contacted because of the way that the system between the doctor and the SUD part go. And so Fawn, not being trained in medication or even knowing anything technically about the detail of a disorder, mental disorder, she has to go by the guidelines of whatever the business has.
Yeah.
Which then until puts up a wall for me to be able to get the treatment that I need to be, recover from, to better myself, because that's what recovery is, to better yourself.
Right. Okay. So to answer your question, I think it would be more abstinent.
Okay, that's what I was thinking too, because it seemed that way. And that's not what Fawn's a addiction recovery specialist. You know what I'm saying? So those don't even match up or even line up there, which that raises feathers. And why is this guy being, is this guy just a smart ass, or no, it's the fact that you guys keep, not you, but things get brought up and then I end up looking into it, and then the autism, oh, here's a bubble, and I'm in a bubble room.
Yeah. Okay. Give me 1 second. That way I can finish up the note of everything
Okay.
that we just talked about, and that way I can see who I have available so we can figure this out.
And I don't remember the lady's name, but she's maybe like 6 foot tall, kind of like huskier. Not, I wouldn't say big, but she's like huskier.
Okay. Is he like short hair?
Yeah.
Okay, that would be Heidi.
Yes, Heidi, and then there was I think it was Cher, something like that started with an S, because it was the one underneath Heidi. And those two are the ones that dealt with most of it before I even did my assessment, like I think it was last July.
Okay.
And I get why, the emphasis from the PO calling and saying, it's been a year now. I'm just assuming that's what happened, and then them looking at the system being like, oh, whoa, it has been a year. But even the fact of Heidi not even contacting Haley and saying, hey, what's going on, or even my PO contacting Haley to find out how I'm doing in my mental health when I'm ordered through mental health through the courts. Like, it's signed and that's actually a wrote-in thing by the judge. So it's like the stuff that the judge has ordered, they're overlooking that just because they're trying to make the entity or the person happy that's with that entity of the probation office.
Right. Okay.
So yeah,
All right.
I'll
Well, then,
hold because I'll ramble your ear off. I'll hold.
that's okay. I just want to make sure I have everything here so that way we can get this situation figured out, okay?
Okay.
So we can direct you to the right person and we can figure this out.
Okay. Did you want to call me back or to give you more time to look into
No,
it, or?
just go ahead and put you on hold for just
Okay.
a second.
Okay.
All right. Thank you.
All right. Thank you.